bringing health and social care together. The new system, overseeing both, aims to do this and ensure there's a closer working relationship, which should mean better care and support for all of us. Healthwatch Norfolk's statutory role is to ensure the voice of the patient is at the core of this, taking your views, ensuring they're passed to those who make the decisions and, when necessary, holding bosses to account. We've done that this year. Dentistry and the difficulty of getting NHS non-emergency care made up just over half of all our inquiries. We ensured the breadth of concern was reported to health leaders on a local, regional and national level, including sharing it with the government's Health Select Committee. This remains a priority for us and we'll be ensuring progress is made on dealing with this huge gap in care, now that responsibility for dentistry rests at a local level. The future of the Norwich Walk-in Centre was also a major worry for many. While we accept that services need to be renewed and revised regularly, we highlighted flaws in the way the consultation was carried out, a view supported by the local community and many of those working within healthcare. Indeed, the walk-in centre was something we did some work on ourselves during the year, talking to patients and understanding what worked well and what could be improved. Around 250 people a day use it, and we discovered a need for more clinics, better communication about its work, and improved partnerships with GPs to share records and therefore enhance treatment. Better communication has been a key thread of what we've been finding out. We worked with the Queen Elizabeth Hospital in Kings Lynn to help them enhance the way they communicate with their communities, whether around appointments or future developments at the site. We also contacted all the health trusts with responsibility for Norfolk to find out about the efforts they make to ensure their communications are accessible. The results varied, some doing a lot of work on it already, while others saying there were still improvements to make. Our engagement also revealed there was work to do around translation for those patients who didn't speak English. The NHS is promising all patients better digital access to care by the end of 2024 for those who want it. We asked patients and healthcare professionals about their experiences so far, and the findings included clearer information about the digital systems out there, better promotion of them, and also tidying up the footfall system to make it clearer for those practices who use it. We completed the first 12 months of a 3-year programme to evaluate the transformation of community mental health. 5 different groups of people were engaged with, including adults severely affected by mental illness, their carers and support staff, voluntary organisations and care employees. Among the initial outcomes were people wanting to see greater trust, continuity around their care, and making sure carers are part of these discussions as well so they can give appropriate support. Where things are working well, they need to be communicated better, and there was also a feeling that more involvement in shaping services was needed from the voluntary sector. Ways of preventing people in Norfolk needing health and social care were also investigated. We found a number of ways of helping with this, including the use of technology, more being done in the workplace around health and social care, making sure that messaging from health and social care is consistent and not just about pressures, and also to start prevention work at a young age. People with pressure ulcers and lower leg wounds and their carers took part in a series of interviews to find out about their experiences of care. We found better training and communication was needed, as well as a greater availability of knowledge and information about these conditions. We also evaluated the pilot Waiting Well project, which supports people waiting for orthopaedic surgery in parts of Norfolk, with help like home adaptations, physiotherapy and well-being support. The project got a mixed response, and we suggested more communication about it, including information leaflets and a follow-up process to ensure the Waiting Well support was received. And we worked with patient participation groups to find out what extra help they needed to support practices and help to be their face in the community. A number of recommendations were given to the Norfolk and Waveney ICB, which asked for the study, around extra help, including more communication, recognition of the role of PPGs, and a mechanism for recommendations they make to be taken forward. Our engagement team have been very busy. They've carried out at least 130 visits to GPs, dentists, pharmacies, libraries, community centres and major events to hear about people's experiences of health and social care. Talking to people face to face remains absolutely vital to ensure we're getting rich feedback about the care and support people are getting. The team also carried out a piece of targeted engagement at GP practices, visiting 50 across Norfolk. This gained an idea of the challenges being faced, and we published recommendations to improve things, including shorter waits on phones, the opportunity to share best practice between surgeries, and better communication and information sharing. Our signposting service remained busy as we helped 471 people with information, advice and support if they needed help with any aspect of health and social care. In addition, we received 2,656 reviews on our website about different providers. We also created digital information about a number of different subjects, including the progress of the Shared Care Record scheme, which means people across different hospitals and care settings have access to your information so you don't have to keep repeating yourself. The toolkit for PPGs, fire safety advice, information for carers, and a behind-the-scenes look at a pharmacy to understand the process from prescription to getting medication. This work doesn't stop there. We're publishing a number of reports this summer on various subjects, including our ongoing evaluation of community mental health in Norfolk, pharmacies in the county, and our My Views Matter project, looking at residential care for people with learning disabilities and autism. We've also just completed our 3 hospitals 3 weeks engagement project, which saw us spend a week each at the Norfolk and Norwich University Hospital, James Paget Hospital in Galston and Queen Elizabeth in Kings Lynn. It was a chance for the whole team to chat to patients, their loved ones and staff about their experiences, and full reports of what we found will be published by this autumn. Even though we're anticipating another busy 12 months, we still urge you to leave your feedback with us and share your experiences, face to face, by phone or online. We are here to listen and share your views with those shaping care across health and social care.